Hi, this is Travis Pearson. This is Mn669 Unit 4 Journal for the week. I'm supposed to describe a new experience or a significant patient interaction or a diagnosis I've never seen before. It's not really exactly a diagnosis I've never seen before, but it has to do more with children and PTSD. As a person, a psychiatric nurse that deals a lot with psychiatric patients that have multiple diagnoses, anxiety, depression, PTSD, it's a little different seeing children come in for actual post-traumatic stress from some type of trauma in their life. So I feel like that is like a first line situation where I'm actually seeing the trauma that has just happened within the last year or two and the patient's coping of how they're going to have to deal with this for the rest of their life. And it's kind of eye-opening for me because I usually don't have to deal with the trauma on a direct basis. I get a patient that'll come in once in a while and have like a precipitating factor, some kind of like a death in their family that precipitates the post-traumatic stress. But now I'm dealing with like the kids and how they're actually dealing with the PTSD and just watching, holy cow, there's some terrible humans out there. I knew there was already, but I feel like when you're a psych nurse practitioner, kid provider, you are like a front line. You're like on the front row of the concert and you're seeing this and you're trying to help these kids get through this. And then you see all the behaviors that are associated with it, the impulse control, the acting out in school, and the parents just being overwhelmed with this and like not being able to understand, and then trying to get them into therapy. And then we can't get into therapy because they're months, 6 months. I just checked, we checked on a referral for one of our younger patients, I think 6 or 8, that needed some therapy for like, it was physical and emotional abuse from the father. And it's 6 months. So now we have this child that has medication management, no ability to express their desires, fears to a family member they can trust. They have like parental issues with their mom. Their mom's at wit's ends. The mom's on caregiver fatigue. I mean, it just feels like when I see these patients, I'm like, I can't believe that this is what it is like dealing with children. So I knew this would be a good clinical for me because I'm just learning so much, because I didn't know as much as I thought. Every time I learn something, I know less. So it's just been an interesting ride. So that is not a new diagnosis or anything, but it's a more revelation of how that diagnosis does affect the children at this particular stage and how their brain can compartmentalize and understand these different things. And it just kind of gives me more understanding of why they're impulsive and have all these behavior problems at school. So this is Travis Pearson. This is my journal. Thanks. Bye.